us for introducing Central Coast electronic referrals. My name is Phoebe James, and I'm a Professional Development Officer with the Hunter New England and Central Coast Primary Health Network. Before we begin, I would like to acknowledge the traditional custodians of the lands we are all meeting on today. I am coming to you from Awabakal and pay my respects to elders past, present, and any First Nations people joining us. Allow me to introduce our presenters. First of all, we have Sarah Houlihan, who is a Primary Care Improvement Officer with the Hunter New England and Central Coast Primary Health Network. Siddharth Ramani, an Engaged Outpatients Project Manager for eHealth New South Wales. And Shiromi Gasperson, Engaged Outpatients Change Manager for the Central Coast Local Health District. I'll hand over to Sarah.
Thanks, Phoebe. So obviously the eHealth and Central Coast Local Health District will go into detail around the e-referral changes. But while we are here today, I wanted to just do a very quick overview of secure messaging in general, because obviously e-referrals are just one part of the secure messaging initiative. So when we're talking secure messaging, the crux of it being, of course, it's the secure transfer of information between health and care providers. When a message is sent, it is encrypted, which means that your patient confidentiality is protected. And as we know with the HealthLink solution, there are options for Commonwealth programs such as My Aged Care referrals. There's state-based ones such as the driver's license. And now we have the local, which is also part of, I guess, state for New South Wales Health, for doing the e-referrals into our local hospitals. So the great thing about the solution that Central Coast Local Health District have gone with is that we know that HealthLink is already available in all of our practices on the coast and in the surrounding areas. So no matter which software you're using, you don't need to download any new software. There's no cost to you. And your doctors are very likely familiar with the system, so they're not having to learn something new. I know that Sid and Shiromi will go further into the benefits of secure messaging, but obviously the Digital Health Agency do outline for us the improvements to coordination, security, administrative and clinical care. And the biggest for most practices, of course, is that once a referral has been sent electronically, your patient can't lose it. And we know that's a big bonus for you in reducing those referral reprint requests. So if you are looking to learn anything more about secure messaging in general, you can find fact sheets, FAQs, and user guides for all the different software that you may use in general practice on the Australian Digital Health Agency website. And when these slides are available in the Education Library, all these links will be live, so you can click straight on it. I wanted to just remind you that we do have on our PHN website lots of resources to assist you with managing digital health, including your e-referrals and any other digital health solutions that you might be using. So you'll see in our main website under health professionals, general practice, digital health in general practice, we've got a whole selection here on this page of sample PDSAs, how to interpret your data and dashboards, suggestions on quality improvement activities you might like to do around digital health. And then in our digital health tab itself, that's where you'll find the Healthy Together Digital Care Toolbox. And you'll see here we've got this brand new tile, Central Coast e-referrals, which is fantastic because that contains the information for you to back up what we are talking about today, the benefits of using the e-referrals for the selected areas. And there's also direct links there into the Central Coast Health Pathways and the Local Health District website. Now, I know we've got people on the call, people watching the video, who will possibly be using both the Central Coast e-referrals and the Hunter New England Cent referrals. And it's important for us to address that they are two separate systems. So Hunter New England Local Health District have their public service, any of their public referrals going through the Cent e-referral, and that's unchanged. The Central Coast Local Health District have got the 4 services to start with, that they'll be accepting those e-referrals. Anything outside of that, so for other specialties within Central Coast, for your private referrers in Hunter New England who are not on Cent, you continue to do your referrals just as you always have done. If you're ever not sure, Health Pathways will show you the right direction to take. And then, of course, we always need to remember that our accreditation is such an important part of our practice, and the RACGP certainly supports the use of electronic technology as much as we can, and certainly when we're talking secure messaging, they do their position statement, which I've linked here for you, does support that secure messaging is the safest, most secure and most efficient communication method that you can use. And then finally, the Central Coast Local Health Pathways have got an information page on there for you, which you can access via the QR code or the link, and that will give you further information for what we're teaching you today. So that's everything for me. I'll pass over now to Sid. Thank you, Sid, if I just stop sharing.
No worries, I'll share my screen. Thank you very much for that, Sarah. Hello, everyone. I'm just about to share my screen, put it in presentation mode. Okay, yes. So I'd like to begin today by acknowledging the Darkinjung people who are the traditional owners of the land we meet on today, and pay my respects to elders past, present, and I extend that respect to Aboriginal and Torres Strait Islander people here today. Just a bit about what we're going to cover today. We'll give you an overview of the project and the solution, what services are in scope for Central Coast District, key milestones and timelines, next steps for Central Coast Local Health District, the e-referral benefits, and the demonstration of the HealthLink smart forms. And yeah, we'll take your questions through the survey as that's sent out. Just going over to the overview. So as we know, about 80% of the referrals that come in today are via fax, and fax, I think, was invented over 100 years ago. So we want to switch to the digital age, and that's the really key case for change, so that we enable, as Sarah mentioned, secure exchange of clinical documents between the referrer and the LHD. This project is sponsored by the Ministry of Health, so we're working closely with the Ministry of Health from a outpatient services guideline perspective, and also very closely, obviously, with the local health district and the PHN to deliver the project. And the key target group is GPs, but also other referrers within allied health or optometrists or the other spaces that refer into public health. Just a bit of an overview of the solution. So this project, the Engage Outpatients program, has a number of different areas. So the key area that you're going to interact with is the HealthLink smart forms, the New South Wales Health referrals on the HealthLink smart forms. As you can see listed out there, it integrates very tightly with a lot of your practice management software, best practice, medical director, Genie, Medtech, Shexi, Platinum, and ZMed. And it enables the secure messaging through to the electronic referral management system that the local health district will use. They will use that to receive, screen, triage, and then send the referral into post-triage admin. And there are notifications both to yourself as a referrer and to the patient at various times. We'll go into detail of where that notification is going to. And it's important to note that this implementation is a significant change for the local health district as well, for the better, to be able to provide better patient care. So we've rolled out e-referrals across the state. So southeastern Sydney, Western Sydney, and Illawarra Shoalhaven. Illawarra Shoalhaven went live very recently in March. But we can see great success across the state of the e-referral numbers, with over close to 3,000 referrals now in a month that we're getting. And we can see about 250 odd practices that are now using e-referrals. And we're getting great feedback from the GPs across the state. We've run some evaluation, and the feedback has been that it's free, it's easy, it's an efficient tool to use, and it's very convenient. And the two-way interaction that happens between the local health district and the referrer is streamlined, and that's sort of what's coming through. And also the other important thing to note here is it follows the same logic as the driver's assessment and the My Aged Care referrals. So it's a familiar tool for most of you out there. So it should be an easy transition to be able to use this with the Central Coast Local Health District. The key benefits are you get near real-time transmission and acknowledgements back and forth. So every time the message is sent, you get an acknowledgement, and every stage of it, you get a variety of acknowledgements. We'll go into the detail a bit later on. It's fully integrated with all the practice management software like we touched on earlier. You get copies of the referrals that are saved within your practice management software. It reduces the possible errors arising from manual processes that we have in place today. It supports faster communication and continuity of care, and faster interventions, resulting in better health outcomes. And it's got the referral criteria, the recommended referral criteria embedded within it. So you've got the statewide referral criteria embedded within the gastroenterology form, and the other forms have the recommended referral criteria embedded in there, which reduces the necessity for following up on what else is required for the referral. So that makes it a much more streamlined process. I'll hand over to Shiromi at this point to talk you through the scope for Central Coast Local Health District.
Perfect. Thank you, Sid. In terms of CCLHD, we're taking a district approach. So we're not doing it hospital-based, but we're looking at where referrals are centrally managed and going from there. So for the 4 services on the screen, we're looking at managing these services via e-referrals. So the first one is antenatal, then gynecology, pediatric, and for the neurology clinic, this is from a specialist centre perspective, which is only at Gosford. We're not looking at outpatients, so just ensuring that you have that distinguished in your minds when you're sending the e-referrals. So for the above 3 clinics, the antenatal, gynecology, and pediatric will be managing that from a district perspective. So all patients that you would like to send to Wyong and Gosford, please send it via an e-referral form, and we'll have that central intake at the preferred service, and we'll designate a patient to either site based on their condition as well as their home address. So those are the 4 clinics that we're going live with this initial rollout. In terms of key milestones, where we're up to and we're looking at, on the 2nd of April, we'll be doing a soft launch, so a controlled release of our forms. And we've had an overwhelming positive response from our GP community, with over 79 GPs volunteering to take part, over 11 GP practices, which is very exciting. And they will have early access to these forms on the 2nd of April, and they will send through non-urgent e-referrals to our system at the LAHD, which will then ingest those e-referrals. Notifications will be sent to referrers, such as yourselves, and to patients to keep them abreast of where the referral is at in terms of its processing. And so non-e-referrals, such as faxes, emails, things that come in the mail, will also be processed manually as per the current practice. There will be no changes to that. However, from the 9th of April, which is our hard launch, our state launch, essentially, we will be looking at a release of the CCLHD e-referral forms across New South Wales. And this is where non-urgent and urgent referrals will be sent to the clinics that are in scope that were mentioned before. And we will no longer looking at really processing those faxes. We're trying to phase that out. Notifications again will be sent to referrers and patients, and the benefit of doing this now with the hard launch is that it'll be sent to all patients regardless of the referral modality that comes in. Post go live, so after the 10th of April, or the 9th of April really, we'll be looking at continue our communications with the PHN and to essentially keep that forum open between us and the GPs to give a little bit of feedback and also receive feedback as to how things are going. We'll really be phasing out those faxes, as Sid mentioned, over 100 years ago, that this was created, and we'll look to kind of educate our GPs within the CCLHD via the GP webinar on the 10th of April, just to make sure that they're kept up to date with what's happening and what our plan is for the cessation of faxing. Thanks, Sid.
Thank you, Shiromi. I'll now go into the demonstration next. Bear with me 1 second. Look screens. So what we have on our screen is the demo HealthLink site, and just a few key points to note here. The development of this form, we've done it in quite a consultative manner. We've had local health district clinicians from the local health district participate in the specialty focus groups and provide the input of what they would like to see within the referral. So that touches on that point that I mentioned earlier about recommended referral criteria. And the other part is we wanted to make sure that the forms were user-friendly, so we had a panel of GPs again across the state participate and provide that usability feedback with regards to the forms to make sure they're simple, easy, and the flow is effective, so that it makes for a great user experience. We made sure there was consistency of user experience, and also balancing act with the local health district on the number of criteria that's required. So some more points to note. As I mentioned, this is the demo environment, so your screen won't look as busy as this. We have a lot more local health districts listed out here. The other point to note is that some of the functionality is more like a mock-up, because this environment is not integrated with the practice management software. So you'll see a bit of a mock-up of the demonstration. And the way you will arrive to this screen is within your practice management software. You will have the HealthLink icon up the top. You can click on that, launch it, and then it'll bring you to this web page. And when you come into this web page, you will look at the New South Wales Health Outpatient Referral to Central Coast Local Health District for this link, and that launches into the services that are currently that are going to be live as of the 9th of April. You can see the services listed are consistent with what was presented by Shiromi earlier. So I'll just click the antenatal form for the purpose of this demonstration, and then continue to launch the form. Just to note that the demo site has been a bit slow off lately, so apologies for the slowness, but we should be able to get through to the next step shortly. Almost there. Thankfully, that's loaded. The production site won't be this slow. It's quite responsive. We're just experiencing some technical difficulties, so we're working closely with HealthLink to resolve that. So as the form loads, there's a number of tabs that you might already be familiar with from the driver's assessment and the aged care referrals. So I'll just quickly give you an overview. Most of the referral interaction happens in the requested information tab that you see here. But I'll quickly take you through the functionality of these other tabs. Attachments and reports are pre-populated from your practice management software with all the attachments in the patient context. And also you can attach from your local PC if there are reports that are stored within there. Similarly, you've got medication allergies and alerts that also pre-populate, and you can select or unselect which ones are relevant for this particular referral. Similarly with the medical, social and family history, and the patient information such as the Medicare number, DVA number, and the private health information is pre-populated from your practice management software, along with the information about the Aboriginal Torres Strait Islander status, address information and next of kin, if any. Referrer information, that's your information, is also pre-populated from your practice management software. So this already makes a lot of the information, mandatory information that's required, it pulls through, so it makes for a streamlined referral experience. So back to the requested information tab, which is where most of your interaction will take place. You will have the option to select from a list of the clinicians that are part of the Central Coast Local Health District antenatal service. But you'll also always have the option to select an unnamed referral if you're not sure who in particular to refer to. Selection of a named clinician helps the Central Coast Local Health District from a billing perspective, so that's mostly preferred. But like I said, yeah, there's an option to select the unnamed referral as well. Referral date defaults to today. Referral type is new, and there's continuation. So an update feature is going to be coming in shortly, and we'll present information about that in upcoming webinars. The referral period, you can choose between 12, 3 months and indefinite. Referral priority, this is your assessment of what the referral priority is. Now for the antenatal form in particular, it's defaulted to 30 days as the 365 days is not applicable in the case of antenatal referrals. And you've got semi-urgent and rapid access. Just a point on rapid access, when you select rapid access, please associate that with a phone call to the local health district on the contacts listed out. We also encourage you to use the Health Pathways link here to check if there are any local referral criteria over and above what's listed out in this form. And then you can also see here the some selections about the patient availability for appointments at short notice and virtual care suitability, which will help the assessment within the LHD. You can provide referral details from your practice management software by loading it with what's available in your practice management software. You can then select it attach it and make edits, or you can just type in the narrative that you would like to make while you're making referral, and any additional information that's useful for the triaging of the referral. You've got options to select the model of care that the patient would prefer. Mandatory fields denoted by red asterisks here for information about the patient, and the estimated delivery date. You also have an option to make it undeterminable in case it's unknown for the patient. And any pregnancy complications, this defaulted to yes, prompting to ascertain the details of the complication, but you can simply select no if there are no pregnancy complications, and that collapses away. Patient consent, so again, another mandatory selection. This is captures the patient consent to exchange the information electronically between the HealthLinks platforms and the New South Wales Health electronic referral management system. And again, the measurement details are pre-populated from your practice management software. So once you tick that and fill out the mandatory fields, you'd be able to progress to submission, or you can preview this form. The form will warn you if there are mandatory fields that haven't been completed. So once you make relevant selections, you will be able to progress to the next steps. One last selection, and then you're able to preview the form or park it if you're awaiting information. And on the receiving end, along with the reports that are attached, the LHD will be able to see a PDF that you're able to see here, so that alongside getting the data atomically into the electronic referral management system, so that it'll help them progress the referral through. And then you progress to submit, and then that securely gets transmitted to the Central Coast Antenatal Service. At this point, the patient and the referrer will get notifications, which I'll delve into the detail for now. That sums up the demonstration. I'll switch over and go to the slide pack. Bear with me to talk through the notifications that the patient and the referrer will receive. Okay. So as I mentioned, the patient receives, there are various notifications that become available through the e-referrals. So as you can see, if you submit via fax or paper, these notifications aren't available as of today. But with the electronic referral management system, the patient will receive notifications even when it's sent through via fax from the 10th. So you can see the various steps. Upon receipt, you get an immediate notification. So that's when you trigger that submit button. That's the receipt notification. If the LHD require additional information, they can put the referral on hold, and you get a notification about that, and you can get the ad hoc communication that the LHD or yourself need to make about the referral. You're able to initiate that and transact. With the local health district centralizing all the communication in one place, you get notification when the screening outcome is completed and it's not accepted. When it's accepted, there is no notification. We're taking that approach of, the positive feedback loop, where if it's progressing to the next step, there is no notification. Where the referral's redirected, so if it's gone from one facility to another, because that redirection is better suited to provide care for the patient. Get notified by the referrer and the patient. And reassignment of the referral, there is no notification there because that's more of an internal process. And triage outcome, both the referrer and the patient are notified. Cancelled as well if for whatever reason, if it's withdrawn by patient, withdrawn by the referrer, or unable to contact patient, or referrer did not respond, any of those reasons, there'll be a notification for that. So these notifications keep both the patient and the referrer abreast of all the different steps within the process of the referral management. Going to next slide. So here's how the notifications will look like. Referral receipt, you'll get the summary of where it's coming from and, you know, that it's been received, and referral placed on hold, and the reason why. You'll get notifications when the referral is triaged, sorry, and referral is cancelled if the referral is cancelled. And this is how you'd be able to see it within the patient context. So here you can see Engage Optimus Prime has a couple of notifications, and there's one that's requiring additional information that's noted in the message there. So you see it within the patient context within your practice management software, so you can go in and respond to those notifications. So we've got a number of different resources that will be disseminated as part of this recording and shared via the PHN as part of this pack as well. So you're able to access this for, you know, further understanding for yourselves of details about this project, and additional resources and tutorials. And you've got obviously myself as a key contact and the LHD project manager as a key contact should you have any questions. And finally, there's going to be another information session on the 10th of April, which will have a similar flow, and we'll take you through this session. And at that point, we would have gone live. So it'd be great to attend that session if you'd like a live demonstration at this point.
Perfect. Well, thank you very much. I just want to take the opportunity to thank all three of our presenters today. Each of them have a 9-to-5 job, and this is definitely above and beyond creating the presentation and also taking the time to record it. So really appreciate it. Thank you to everyone who is watching it, because, you know, this is the whole point, getting the information out there. And yeah, thank you, everyone. Take care of yourselves.
Yes. Thank you.
Thank you.